House Bill 3 will alleviate some of the financial burden of health insurance for those using the marketplace. First, by creating a state-based health insurance exchange in Pennsylvania. Second, by increasing access to affordable care. And third, doing all this without putting more money into our healthcare system than we already have put into it. This year, the federal government will charge Pennsylvanians nearly $100 million in fees to cover the costs of operating healthcare.gov. Because of the advancements in technology, states can now purchase platforms to run their own equivalent of healthcare.gov for as little as $30 million. That is, we have been using the federal computer system for operating our exchange. We can now, for $30 million, basically have our own. It's my goal to have no Pennsylvanian worrying about affording the care they or their loved ones need. This new law represents another major milestone for Pennsylvanians. It continues the progress we've already made. More than 1 million individuals, families, and children now have better access to the health care that they need. More than 400,000 people buying insurance in the marketplace who are now going to have access to more affordable health care. This bill is a huge step forward toward making health insurance affordable and effective for all Pennsylvanians.
I'm incredibly proud to be taking a step like the one we are announcing today that will continue to make healthcare more accessible and more affordable for those that buy health insurance for themselves and their families. And that does so simply by using the dollars already going into our healthcare system better and more efficiently. We will not delay the ability of Pennsylvanians to realize meaningful savings in their health insurance premiums. For the roughly 400,000 Pennsylvanians buying individual health insurance, this initiative will result in premiums being 5 to 10% lower than they would have been if we were to stay with the federal marketplace at healthcare.gov. This reduction in premiums will especially help those Pennsylvanians whose incomes are too high to qualify for a tax subsidy, many of whom struggle to afford their coverage today, and that's about 1 in 5 Pennsylvanians who purchase coverage on the exchange.
I think that we would all agree that saving money and increasing access to health care are not partisan issues. In fact, they're issues that should be our guiding light in how we approach and solve problems like these.
This was never a Republican or a Democratic issue. It's a great example of how we can and should work together across party lines. We can make sure everyone can afford to see a doctor when they get sick. We can help our job-supporting healthcare providers.
Okay, I'd be happy to take any questions on topic, by which I mean that if I can't answer them, one of these 3 people will actually give you the Banking and Insurance Committee in the Senate. So thank you for being here. Well, thank you for being here too. It's good to see you too. So anyway, I want to just talk about what I'm going to do today, sign into law a bipartisan bill, and it really was a bipartisan bill. I think was passed unanimously in both the House and the Senate. That shows what we can accomplish when we all work together in this building. Every elected official, blue or red, urban, suburban, or rural, all of us have constituents who are coping with the healthcare affordability crisis that we all face.
you.